What functional deficit would be observed if this nerve was lesioned? Gabby here from bootcamp.com, and here we're going to be discussing some of the aspects of the anterior chest wall and some of the muscles and nerves that innervate those muscles. So let's start off by orienting ourselves here. So more superiorly, we're able to see the right clavicle, and then again on the other side here, we'll be able to see the left clavicle. So we see that we've actually reflected a large fan-shaped muscle. So this is a very large muscle that sits along the anterior chest wall. So it is found fairly superficial, and we've reflected this muscle in order for us to better visualize the neurovasculature that is found underneath, as well as the muscles that are found deep to it. Now, you probably know what this big muscle here, it starts in the areas or originates along the areas of the clavicle, forming its clavicular head, and it also originates along the sternum and along the costal cartilages of the ribs. So that's going to be its sternocostal head. So if you don't know already, this muscle right here and here as well is going to be the pectoralis major muscle. So the pectoralis major is going to originate on the clavicle, the sternum, and the costal cartilages, then eventually go ahead and travel to insert. It's going to pass the shoulder joint and eventually go ahead to insert on the humerus. So therefore, if we visualize this muscle contracting, so remember that insertion always moves to origin point, the sternocostal head of the pectoralis major muscle is going to help with adduction and medial rotation of the humerus. We do have the clavicular head, which will have some fibers that will actually assist with flexion of the shoulder joint or of the humerus. But nonetheless, to answer this question, we really need to understand, one, the functions of these muscles, but also the nerves that innervate these muscles. So we just talked about the pectoralis major muscle. Let's go deep to that and talk about its little brother right over here, the pectoralis minor. So the pectoralis minor muscle is going to originate along ribs 2, 3, 4, and 5, and then will eventually go to insert along the coracoid process of the scapula. So as you can imagine, if the pectoralis minor muscle were to contract, it's going to pull on that coracoid process. It's going to stabilize the scapula along the posterior thoracic cage. So now that we understand the functions of both of the pectoralis muscles, it's important to understand the nerves that innervate these muscles. So as we mentioned, the pectoralis major right over here, we can see a nerve that travels and goes to innervate it, and we can see it on this side as well. So I want you to think for a second which nerves innervate the pectoralis major muscle. So this one specifically is going to be the lateral pectoral nerve. So the lateral pectoral nerve, as the name implies, comes off the lateral cord of the brachial plexus and eventually travels to go and innervate the pectoralis major muscle, which we can see right here. We have another pectoral nerve that also innervates the pectoralis major muscle, and that's going to be the medial pectoral nerve. So instead of coming off the lateral cord, like the lateral pectoral nerve, the medial pectoral nerve is actually going to go ahead and come off the medial cord of the brachial plexus. And then after, it will travel and eventually go to innervate the pectoralis major muscle as well. So the pectoralis major muscle receives double innervation from the lateral pectoral nerve and the medial pectoral nerve. Now, how about the innervation of the pectoralis minor muscle? So the pectoralis minor muscle, as you can see, the medial pectoral nerve ends up piercing the pectoralis minor muscle. So that being said, because the nerve pierces the muscle, it likely innervates it. So the medial pectoral nerve is going to innervate the pectoralis minor muscle. So that being said, let's get back to our question here. So what functional deficit would be observed if the medial pectoral nerve was lesioned? So because the medial pectoral nerve innervates the pectoralis minor, as well as the sternocostal head of the pectoralis major, we're going to see some weaknesses in those functions that those areas perform. So for example, as we said, the pectoralis minor, we are going to see weakened scapular stabilization because the pec minor can't perform its action. And we also know, like I said, how the sternocostal head is going to help with adduction and medial rotation of the humerus. So if that head can't perform its function, we would also see weakened shoulder adduction and medial rotation. So let's just double check our answer here and seize the correct answer.